Hello, good afternoon. Nice. Hello, good afternoon, everybody. We'll start the webinar quite soon. We were just waiting for a few more people to arrive. And meanwhile, I will invite you to introduce yourself in the chat and tell us where you're joining us from. Yeah, it's a pleasure to have all of you here. And feel free also to use the chat to connect, share your thoughts, ideas. Yeah. Yeah, the chat should be working. So let us know where you're from. Yeah, it would be nice to have some message from you. And we'll start quite soon. So yeah. I see you have someone from Deusto, University of Deusto in Spain. Nice to meet you, Begonia. I've seen many participants joining. Great. All right, we'll start in a couple of minutes, just waiting a few more participants to join, and then we'll start this webinar, Championing Healthcare Climate Resilience in Europe. I've seen Guillaume from France. Nice to meet you, Guillaume. Okay. Then I can also introduce myself, and then we start soon. We have two fantastic sessions today in this webinar. I really can't wait to dive in them. I'm Tristan Coubert. I'm the climate officer at Healthcare Resilience Europe. I will be moderating the first session of this webinar. Hello, Charlotte. Nice. The goal of this webinar is to discuss policies and share with you tools and resources to help supporting the healthcare system to become more climate resilient. So how can we do this? Basically, before speaking about it, I would like to briefly introduce the topic. What is climate resilience for the healthcare system? So as defined by WHO, a climate health system is capable of anticipating, responding to, coping with, recovering from, and adapting to climate-related shocks and stress, thus to bring sustained improvement in population health despite an unstable climate. So the other way around, it means if your healthcare system is not resilient, and if there is a climate extreme weather event that happens, such as a flood, a heat wave, you may not be able to provide a sufficient care to your patients. Sometimes your patients might need to be relocated in another hospital or in another region. Maybe you will have a lack of workforce, a shortage of resources such as electricity, water. Is definitely something we would like to avoid. And I think it's the goal of this webinar is to provide you resources for your healthcare facilities, but also for your healthcare system to become more climate resilient. So for this, we try to make an agenda that could answer all of these questions and match your needs. In the session one, we will have a presentation of the LIFE RESYSTAL project. So not only the project, but also the tools and resources that could be concrete for you at the healthcare facility level to improve your climate resilience. Then we will launch the practical guide for building climate resilient health systems. So this resources is new. It has just been launched. Will be on our website of Healthcare Resilience Europe. And the goal is to support healthcare systems to improve their climate resilience. In session two, we'll have a great discussion on policy. So what are the policies that could champion healthcare climate resilience in Europe? We'll have a great panel session with three great speakers, and and a great moderator, Janet Picon-Mayari. So just before we start this webinar, a couple of things. This webinar is being recorded and it will be shared later on our YouTube channel. So please use the chat to share your thoughts, comments, and why not networking. It's always nice to see engaging audience, and maybe you could do some nice connections. And please use the Q&A tab if you have some questions to our speakers. And it would be very helpful if you could indicate to whom your question is directed to. And we will answer this question during the two specific Q&A sessions. All right, so now I will give the floor to the next speaker, to the first speaker. His name is Stelios Karosis. He's the coordinator and researcher at National Center for Scientific Research, Democratos. And Stelios, I need to present the LIFE RESYSTAL project and what are the tools and resources that we have been developed and we are developing to create more climate resilient healthcare facilities. Stelios.
Thanks, Tristan. Hello, everybody. I'll start the presentation, the structured presentation. It's, let's say, two-part. One is a very, very short description of LIFE RESYSTAL, the objectives of the project, because not everybody is familiar with. And then I'll try to present the outcomes of the project in the less technical way and more in the end user perspective, and mainly what are the overall outcomes of the project, how they can be utilized, let's say, from an evidence-informed policy making, and how they fill gaps of the different policy frameworks. To that end, LIFE RESYSTAL is a live project, as the name suggests. For those that are not they don't know, live projects are a close-to-market project from the European Union, so it's not very novel, innovative methodologies, but mature ones that can be combined together creates a product close to market. The project is over 5 million with 55% EU co-funding, with Demokritos from Greece being the coordinator and responsible for some of the analysis, with Cambridge, Actera, Arena, Chrysoft, and HCWH be the technical partners. We have 3 organizations that represent 5 pilot hospitals where we validate our methodologies and tools. And also we implement some green and blue adaptation measures to combat climate change in their healthcare facility. The objectives of the project, as you may guess, the project tried to create methods, frameworks, tools, and methodologies to help healthcare facilities to be more climate resilient. And one key aspect of that process is that we try to incorporate in our analysis and frameworks a bottom-up approach to engage stakeholders, policymakers, and people around the hospital during the decision-making and the utilization and use of different tools we provide via what we are calling the community of practice, which is local community of practice creating around the healthcare facilities. And as I said, we validate this whole process, tools and frameworks, through the five pilot hospitals of the project. Okay, if I try to categorize the outcomes of the project, the key deliverables of the project in 2 categories, I will end up with 2 parallel, let's say, paths that we followed during the project. One focuses on the healthcare facility itself, and the other is the system level. I stress that the project itself, it focuses on mainly on the healthcare facility and less on the system level, because it's 2 different approaches that requires different approaches and frameworks, and 4 years wasn't enough to focus on both of them. So we put our efforts in the healthcare facility, but we try to provide some hints and guidance how to expand our methodologies and tools to the system level. To that end, with the above, let's say, path, what we offer in the healthcare facility, it's two things mainly. What we are calling a toolbox. It's a set of tools that create step by step. We'll see together in more detail. Step by step analysis, outputs, and quantification of different aspects towards help the end user create a climate action plan and have the necessary tools and evidence to take decisions. Uh, Based on that, and because we would like and want to go beyond life resistal, all this to be work outside the hospitals that are being tested. We create the upscaling adaptation starting packages. It's something that we are working now in the last year of the project mainly, that incorporates the necessary steps in order to utilize all this outside life resistal. So this covers the toolbox itself, uh, how to create your communal practice and best practice, what we learned during creating all this and testing them in the 5 pilot hospitals. The other path, the system level path, is covered, but with the health system guidance, which incorporates a series of things. But I won't focus on my presentation on that, as it will be covered in the next one. All of them is comprise what we are calling life resistal operation framework. So we have on the one side, the healthcare facility level, toolbox and upscaling adaptation starting package, and on the health system level, then on the health system level, the health system guidance. Okay, let's take it one by one. First, the toolbox. It's not something that you can download and put it in your computer. It's a web application that incorporates all the tools and analysis. It is called Toolbox because this is how we described during the beginning of the project, but we end up to couple everything, harmonize them, and offer a more um, a more holistic experience to the end user. So the user cannot understand, cannot separate that it goes from one tool to another, but goes step by step to create the action plan for combat climate change. What's the first step? What the toolbox can do? First, you put some necessary information about your infrastructure, part your infrastructure that you need to assess the climate resilience and provide measures to adapt it. Then we offer tools to download climate scenarios and translate these climate scenarios to climate hazards. For example, download the latest IPCC scenarios, MIP6, and try the climate hazard of heat wave, for example, for the region of Europe. You take this information and progress in order to make your vulnerability analysis, find your vulnerable points in your infrastructure, see how this hazard affect your infrastructure and what is your impacts, and combine all this information with your risk analysis, which end up in this, let's say, image in the bottom, the first in the bottom, where you see your risk matrices, which is very common visualization of the risk in engineering point of view. We use heavily World Health Organization manuals and also the categories that are presented there. Because, as I said in the beginning, I would like this to go beyond life resistal, and a good way is to take World Health Organization manual, which is generalized enough and can be applied to many hospitals, not only for the ones that you create a tool or analysis. After the risk we perform some economic analysis, financial analysis. So we offer the economic losses, how much money you will lose in the future if you do nothing, and this climate hazard will stress your infrastructure. Then this is followed by the adaptation pathway analysis. The user can choose some adaptation measures from a list and also depict, let's say, a way when it is relevant to take these actions. And then by creating these pathways, as we are calling them, a cost benefit. Okay. Um, See which pathway is more financially best to take to implement. Basically, with cost benefit, we say if you spend some money now, how much money you will not lose in the future under the climate change. In the end, we offer also a crisis management tool, which is the operational part of the whole process. So climate change basically mainly change the frequency of extreme events. So another aspect of this is how you change your protocols to engage your staff when there is an extreme event imposed in your region or your facility. The adaptation starting package tries to capitalize on that and everything around the toolbox, which is also the community of practices. So the idea is, and this is work in progress, as I said in the beginning, is manuals how to build your community of practice around the hospital that helps take information needed to use the toolbox. Suggestion guidelines, who to be involved, which is layers around the hospital, not people inside the infrastructure mainly, and also training sessions about life resistal toolbox, how to be used, and what's the best course of action when you use it. Here is just for symmetry, the health system guidance, but more in the next presentation. So having all this, how can be utilized as a whole to help the community, the healthcare community. On one hand, you have the policy framework, which comes from WHO. You have then our key deliverables, the life resistal operational framework, and then the community, where we try to make it more climate resilient. Here you see the climate resilient WHO framework. What we'll try to do is to map our key deliverables to that framework. And it looks like this. With the green box, you see parts of the toolbox. With the gray, the upscaling adaptation starting package, and with light blue color, the health system guidance. And you see, we with our key delivery, we cover things like emergency preparedness management, service delivery, climate health financing, leadership and governance, vulnerability capacity adaptation assessment, health research, climate research, and climate resilience, sustainability, technology, and infrastructure. That's all from my side. Thanks for listening and for your attention. And I'll be happy to take many questions after the next presentation.
Yeah, thank you, Stelios, for the presentation. If you have any questions, you're very free to use the Q&A tabs, or if you have just some comments, you can write them in the chat, and we'll have a look at it. Stelios is staying with us until the end of the webinar. So now I would like to introduce my colleague, Gabriela Bruzzo. She's a climate projects officer at Healthcare Resistance Europe, and she has worked on this practical guide for building climate resilient health systems. And she will tell you more about it and why it's a good resource to improve climate resilience for these health systems. Over to you, Gabriela.
Good afternoon, everyone, and thank you, Tristan, for the introduction. As extreme weather events are increasing their intensity and frequency, it's not enough for the healthcare sector to reduce its impact on climate change. The sector must become resilient to the impact of climate change. That's why, as part of the LIFE RESYSTAL project, Healthcare Without Harm Europe has developed the practical guide for building climate resilient health systems. The guide was created with insight from LIFE RESYSTAL pilot health system, but it has been designed to be applicable to any European health system. The purpose of the guide is to help organizations integrate climate resilience into healthcare planning. The guide is divided into two parts. Part 1 defines key concepts related to climate resilience and health system and explains how climate change affects health system, their infrastructures and services. Part 2 presents a step-by-step approach outlining the essential action required to strengthen resilience and including practical guidance for implementation and case studies. As I said, part 1 includes some key definitions, such the one of climate resilience health system and climate resilience health system. Importantly, following the definition of WHO, climate resilience health systems must provide the healthcare service without additionally contributing to climate change. Indeed, the healthcare sector remains a major contributor to the global emissions, representing 4.6% of net global emissions. Therefore, the climate resilience of health systems depends on their ability to decarbonize operation through climate mitigation measures and adapt to more frequent and severe extreme weather events. This section of the guide also presents climate change impacts on health system and some of the most common climate hazards in Europe. Part 2 of the guide represents the 7-step approach. These steps also include some sub-steps. And as I said, this should be general and flexible enough to be adaptable to the various European health systems. Now I will provide an overview of these 7 steps. To start your journey toward climate resilience and start acting is essential to have support at different level. That's why the first step is to mobilize support. Involvement and commitment at the highest level are necessary to develop strategy, plans, and provoke policy changes. As well, raising public awareness about the impact of climate change on public health and on the healthcare sector is essential. And in this case, healthcare professionals can play a pivotal role. Furthermore, healthcare system cannot strengthen the climate resilience in isolation. That's why health systems need to gather external stakeholders and create cross-sectoral and strong stakeholders network that will enable them to develop a comprehensive and effective climate resilience plan. As mentioned by Stelios, the LIFE RESYSTAL project has developed a methodology to map stakeholders and establish community of practice. And even though this methodology has been piloted through hospitals, it can be scaled up to broader health system. And you can also find a case studies about the LIFE RESYSTAL experience in the guide. So the second step is understand the policy landscape. This process helps a system identify key priorities, develop effective plans, and uncover potential funding opportunities. Step three concern assess the risk. It is important to understand the climate risk the facility within a health system face to make well-informed decisions, set priorities, and design appropriate action and allocate resources. It would be ideal to assess vulnerability risk of the entire health system, but considering the complexity of the system, this kind of assessment at this level are not a common practice. That's why in this case, the role of a system should be to mandate individual facilities to conduct vulnerability risk assessment, favoring a bottom-up approach to ensure quality and accuracy. The result of these facilities, of this assessment, should be aggregated to provide an overall picture of the system current risk of level. This analysis helps the system to identify the major risk and the area most impacted by climate change. Step 4 concern the identified priorities. Once the vulnerability risk assessment has been completed, the health system, together with the facility and the community of practice, can identify the priorities and target areas. Target must be set for each priority identified to support monitoring and evaluation. Feasibility aspects should be considered in this phase, and this includes political commitment, legal and bureaucratic actions, capacity and staff preparedness, and funding. The latter represent one of the major obstacles to climate resilience actions, but it's important to remember that while the climate resilience may appear costly, the cost of inaction is even higher. Arriving to this point, we arrive to step 5, and a health system should gather all the necessary information to develop a health system climate resilience plan. So the health system should have involved and engaged with external stakeholders, identify the level of risk and the intervention and action and the funding streams necessary for the implementation. These parts constitute the backbone of a climate resilience plan. Climate resilience encompasses both climate adaptation and mitigation. Therefore, integrating mitigation is not just important, but is essential to any robust climate resilience plan. The plan is a living document, so it must be periodically updated, renewed, and adjusted. Step 6 is monitor, measure, and track progress. Measuring and tracking progress in relation to climate resilience might be challenging, especially in the absence of extreme weather events. If an extreme weather event is not occurring, you can evaluate your progress towards climate resilience by gathering the data related to the number of health professionals trained or the number of risk and vulnerability assessment completed. If the extreme weather events is occurred, you can evaluate the effectiveness of your action by measuring the internal temperature of your building in case of heat waves, or by assessing the accessibility to the healthcare facility. Even though, and in this case, involving the stakeholders present in the community of practice is fundamental, not only to set the right indicator together, but also to facilitate the gathering of the data. The last step is communication. Even though it's presented as the last step, communication is an overarching activity that should cover the entire process of climate resilience, of the development of climate resilience plan. Communicating and disseminating will encourage change across the entire healthcare sector and the replication of best practices between and across organizations and in different locations. In the guide, you will find key strategies related to this communication. So now you can find our practical guide for building climate resilience systems on HCWH Europe website. And I think you can find also the link in the chat to access to it. And thank you for listening.
Thank you, Gabriela. Now we will start a 5 minutes Q&A session. So if you have any questions, please use the chat. Otherwise, I have a few questions for the speakers, for Stelios and Gabriela. Gabriela, you worked a lot in this practical guide. What would be for you the most challenging step for a healthcare system to be climate resilient?
I think it's always important the first step. To raise awareness and to be aware of the impact that climate change is having on health system and on healthcare facilities is essential for any further actions. And obviously, also, I believe the assess your risk is fundamental, because in that way, you exactly know where to act, what to do, and how much your healthcare facility are impacted by climate change.
Yes, definitely. Stelios, I think in the toolbox we have a climate vulnerability risk assessment tool. So I don't know if you could tell us more about how this tool is quite innovative for healthcare systems, and how it could be able to assess the risk properly.
Yes, thanks for the question. It's innovative in a way that tries to take an end-to-end approach from make the climate analysis, translate it to healthcare risk, provide adaptation measures, and also monetize the whole process. Which was very challenging, how to combine everything and try to find ways to do it. And also from my perspective, it make us, I mean, coming from the climate risk assessment field and not directly or very close at that point in the beginning of the project with healthcare system and how the healthcare infrastructures are operating. It was challenging and the same way, good that we try to change our perspective and focus on what matters in the healthcare facility. So we adapt our methodologies to that, let's say, framework, and try to combine and create the nexus of climate resilience and healthcare facilities. Just to clarify on that, coming from the risk assessment, we tend to focus on inanimate things, I mean the infrastructure itself, and less to the operation and what matters in providing health services. So we try to adjust to that and providing through our tools. So we combine two things, resilient infrastructure, and also try to cover also the other part and use basically the whole climate resilience definition, and less the more engineering risk and resilience definition of the process.
All right. Thank you, both of you. I don't think there's any other question, but feel free if you have them later, and we can also answer in the chat in the Q&A per message. Now I will give the floor to Diana Picon-Magnard. She will be presenting and moderating the panel discussion about policy. Welcome, Diana. You are the International Climate Director at Healthcare Without Harm. You just came back from COP29, so where there were also a lot of policy discussions on climate change, etc., etc. So I'll let you introduce the great panelists we have for this session. Yeah, the first to you, Diana.
Thank you so much, Tristan, and it is great to be here with you today and share the virtual stage with a great lineup of panelists whom I'll introduce in just a minute. Before we get started, just to remind you, please use the chat button to share your thoughts during the session, and submit your questions on the Q&A tab, the question and answer tab. We will pick up these questions during the Q&A session, which will come at the end of this conversation. So now, without further ado, I would like to introduce my new friends. We have three great panelists. First, we have Alexandra Kazmierczak, who is an expert in climate change and human health at the European Environment Agency and coordinator of the European Climate and Health Observatory. We also have Cristina Enjamio, the manager of the consulting department at Galarie of the Galician Health Service. And then finally, we have Peter Loeffler. He's the policy officer specializing in adaptation and resilience to climate change at the Directorate General of the European Commission for Climate Action. Quite the name there. Welcome, the three of you. I am really excited to get going on this conversation. We're going to start local, and we're going to talk about policy here, and we're going to get very specific. And we're also going to be very concise because we have a very short time to answer these questions. So in 3 minutes, I'd like you to answer the following questions. Cristina, we're going to start with you. And as I said, we're going to start local. What kind of policies has Galicia developed to improve climate resilience in the health sector? And how were the region's health facilities involved in the development of these policies?
Good afternoon, everyone. Thank you for the opportunity to explain how Galicia is addressing the challenges of climate change within our healthcare system. First, to answer your question, Diana, at the regional level, the Galician Climate Change and Energy Strategy 2050 is central to our approach. The goal is to cut greenhouse gas emissions and boost resilience across all sectors, including healthcare. Another key initiative is our circular economy strategy specific to our health service. This strategy moves us away from the use and discard model, focusing on better resource management, reducing waste, and promoting sustainability. And through this, Sergas aims for net zero emissions by 2040. At the system level, the Galician Health Strategy 2030 also puts a strong emphasis on climate resilience. It recognizes the health risks posed by climate change and pushes for integrating climate concerns into health planning. This includes investing in sustainable infrastructure, using digital tools, and ensuring the system can adapt to future challenges. At the national level, there is the Spanish Health National Adaptation Plan that provides healthcare facilities with guidelines to manage climate risks and ensure health remains a key part of a broader climate efforts. At the facilities level, healthcare facilities themselves play a central role in this work. As part of the LIFE RESYSTAL project, we have conducted vulnerability assessments for 3 hospitals, identify appropriate strategies, and implement these measures on the ground. This collaboration ensures the policies are practical and tailored to local needs. Monitoring tools and feedback mechanisms are also critical in refining and improving these strategies over time.
Thank you so much for that, Cristina. And really great to see how the local is feeding into the national and vice versa. And really, I love how you also frame this, right? It's not, you're talking about resilience, but you're also talking about sustainability, circular economy, greenhouse gas emissions, something that we're going to get back to towards the end of this conversation, because I want to learn more also about that at a regional level. Alexandra, I'm going to come to you now. You work at the European Climate Observatory too. You know the data. You know what it is saying. What should we be looking for at the EU and member states' policy actions? What should they be undertaking to support climate resilience of the sector?
Thank you for that question. Maybe to start with what we know about the existing policy landscape. A couple of years ago, we did an analysis of the national climate adaptation policies and the national health strategies, and to what extent they cover climate change impacts on health and what actions are being undertaken. And one of the key findings of this analysis was that the action on climate change impacts on health was mainly driven from the climate adaptation side of things, rather than from the health strategies side of things. There were actions being planned, such as more early warning systems, surveillance, setting up appropriate governance structures, more research, and so on, but they were very preparatory in nature for most of them. And in recognition of that, for example, then European countries under the Budapest Declaration, the declaration taken at last year's Ministerial Conference on Environment and Health in Budapest under the WHO Europe, committed to development of health national adaptation plans. At the moment, only several countries in Europe have such plans in place, for example, Ireland, Sweden, Finland, North Macedonia as well. So development of such plans, but also implementation of the existing policies, and not necessarily just in the health sector, but for example, under the Floods Directive or in relation to other commitments, can certainly push the resilience of the health system forward. I think another thing I just wanted to mention briefly is the European Climate Risk Assessment that was published in March this year. And it not only looked at the risks that are present in the health sector, mainly with regards to heat stress, but also coastal pathogens, wildfires, and so on. But it also identified the level of policy readiness to respond to those risks. For most of them, it was at the medium level. So it's also a call for action to take more action in the policy, both at the national and at the European level. And maybe I'll ping pong to Peter at the European level here.
Absolutely. Well, thank you so much for that. And really, really interesting that you're talking about, this gap, perhaps, so the bridging that we need to make between first plans, making sure that we need to get them in place, those policies, and then that implementation, right? To not just leave it on a nice report, but it actually moves us into action. And I will come back later to ask you more about that risk assessment that was done in Europe, a really important piece of work. Peter, over to you now. You are the policy officer in the Commission. You're the core of the system regionally. Health is a shared competency between the EU and the member states, as I understand it, with the latter primarily responsible for the sector. What are the European Union's or what are European mechanisms and policies that can have the most impact on the resilience of the health sector, right? I mean, we just heard Alexandra talk about it's not just about the health sector, what others can do also to help us really become resilient. What can you tell us about that?
Mm-hmm. Thanks for the question, Diana. Before I answer your question, just a moment really to congratulate the RESYSTAL team for the successful LIFE bid and for running this project. I happen to be responsible also for the adaptation strand of the LIFE program, and I do remember when we evaluated this project, and all evaluators felt that this project was highly relevant in the context, and it's actually a pioneering project. It's, to my knowledge, the first ever project to address specifically the health component of climate adaptation. And so, yes, it's a pioneer, and it has, I think, a nice systemic approach, this is the type of projects which we need to put the legal requirements and the policies and the type of agreements which Alexandra has just been talking about to put these things into practice, because this is where we are now. We have a policy framework, but we need to get better on implementation. Now, on the policy framework, and I'm not coming so much from the health policy framework. Of course, you need to work specifically also on health, and we do have the regulation on serious cross-border health threats. This is an important regulation in the context of climate change, but we need a much more systemic approach which addresses health individually at the level of health systems, but also a much wider context. We say in our EU climate adaptation strategy that we need a systemic approach to adaptation. So from that angle, we do have the European climate law in place since 2021, and that involves a legal duty of member states also to adapt to climate change and to have make continuous progress. Member states have to have national adaptation strategies and plans. So this is something which we are monitoring. We do have specific guidelines on how these adaptation strategies and plans should look like. And there must be usually an important health dimension, because all member states tell us that health is one of the most exposed sectors. We do have the European Climate and Health Observatory. Alexandra can talk a lot more about that as a very specific initiative in the field. We have a general adaptation support platform, which is called Climate Adapt. We have a so-called adaptation mission, which puts research to use at the regional and local level. And this is just the overall adaptation policy framework. There are many, many more pieces of legislation, funding, and soft policy tools involved, and I don't think we will have the time to list all of these, but I may pick up on one of these, some of these later on.
Thank you so much for that, Peter. That's really interesting, and also, really understanding what is happening outside the health sector. We don't live in a bubble, of course. The health sector also depends a lot on what other sectors in society do around this issue, and important these national adaptation plans and how they include health in the health dimension. Not just a mention, right? Sometimes we just scan and they say, may include health, yes, but really, let's get into the details about what that means. It would be really important. So we have some limited time for a second round of questions. So I'm going to ask you to be super quick, super concise in this round, maybe a minute and a half to 2 minutes each, please. Christina, based on these answers that Alexandra and Peter just gave us, right, giving us that European context, regional context, which policies at that level might be the most helpful to healthcare facilities in their local context to support climate resilience plans? What would you stress is most important from a European perspective and that may affect you in Galicia?
In my opinion, the major challenge is funding, because without it, plans remains theoretical. Our hospital infrastructure is quite complex, reflecting a mix of old and new buildings, and I believe this is a common situation across much of Europe. Upgrading these facilities to meet modern environmental standards is a significant challenge. Older buildings require substantial investment to be modernized, and newer ones provide opportunities to incorporate sustainable, innovative designs. And balancing these two needs underscores the importance of having a clear and sustainable funding strategy. Collaboration is key to success. We must work closely with local councils to align healthcare strategies with regional climate goals. And this teamwork helps share knowledge and best practices, keeping healthcare centers updated on policies and initiatives. In Galicia, our approach is unique. We tailor health plans to local needs through the so-called local health plans. These plans support effective collaborative planning by prioritizing community health. They focus on making care accessible, proactive, participatory, and well-organized, with an emphasis on evaluation. Also, the Covenant of Majors for Climate and Energy, Sergas, as part of the regional government, supports this covenant with 285 out of 313 municipalities in Galicia committed to climate action. Also, training to health staff on climate change impacts and resilience, ensuring frontline workers are equipped with effective strategies is essential. And additional, the health service needs to collaborate with local organizations, NGOs, universities, and other public institutions or public buildings to raise awareness about climate-related health risks and promoting collaboration.
That's excellent information, Christina. Yeah, I mean, funding seems to be the word of the day, particularly after COP29 too. Something, and financing, right? Something that we need to continue to pay attention to. Alexandra, I want to link this what Christina was talking about. You know, the local efforts, the collaboration. I think that's also, you know, really based on a deep understanding of what are the vulnerabilities and the risks, right, in Europe as a whole, and more locally also contextualize that information. And you mentioned that earlier this year, the European Environment Agency published that first European climate risk assessment. What is this type of analysis telling us about vulnerability and risk in Europe? And why is it important to understand resilience of health systems in the region in this way, the vulnerability of them?
Well, as I mentioned, in the European Climate Risk Assessment, health was one of the key sectors or key areas where the assessment was carried out to identify the main risks. The risks being a sort of a combination of the vulnerability, the exposure, and the actual hazards. So, for example, heat stress to outdoor workers as one of the key risks. And I think it's absolutely crucial to identify those areas, first of all, to be able to target the action, to prioritize the action. We are all working in a situation of limited public resources. So knowing whom to target and whom to prioritize, or which areas, which facilities is absolutely crucial. And secondly, knowing what the baseline situation is also a very important factor to know. If we are to implement adaptation actions or any other measures that are supposed to improve it and be able to actually compare against the baseline situation, are we making sufficient progress with what we are doing or not? Should we change tack? So knowing where the vulnerabilities lie is one of the key aspects of having this overview of the situation and a baseline for further action.
That's really great, Alexandra. And you know, understanding the vulnerabilities obviously are key. Understanding the target actions and the target populations, right? And what are these facilities in terms of the health sector are important. Link that to obviously the funding and how we prioritize funding, perhaps too, as Christina was talking about, in the types of actions too. I want to finalize with this section, at least, of the questions with Peter. Peter, I was just at COP, like Tristan said, the finance COP. The outcomes, as we've probably seen around on LinkedIn, less than perfect. The ambitions, in my opinion, really needed to advance the fight against climate change, constantly challenged. And at the heart, sometimes it feels that we're always having these two separate conversations around mitigation and around adaptation. In this one, this latter one ends up kind of equating to resilience. I kind of want to go back to the first part of this conversation, where, and even the second one, where Christina was talking about both the actions that, you know, her facilities in her region are taking around net zero goals and sustainability and adaptation. How do you see these links between the two types of actions toward resilience happening in Europe?
Yeah, thanks for the question. In a way, this question links also to funding and to financial aspects. I mean, the short answer is we need to do both. This is not a question of either or. This is not a choice. We will need to do our utmost to make the EU and actually the world climate neutral, and stop pumping greenhouse gases into the atmosphere and stop climate change. That is also the most cost-efficient thing we can do. The Green Deal is very much about also turning this into a business opportunity. At the same time, we know that climate change has started, and we will have it at least throughout the century. So we will also need to become more resilient to this and get prepared for what's coming. And in practice, you can't really separate the two things. Just think of a hospital building. I mean, would you make this energy efficient first and then climate resilient in a second step? It doesn't make sense. You know, these are long-term investments. You invest once, into something which does the two things at the same time. These investments make a lot of sense because, as I said, mitigation may be expensive, but if you find mitigation expensive, try climate change. Adaptation may be even more expensive, and if adaptation doesn't work, we are into this debate about loss and damage, which we're having partly at the COP. So it becomes more expensive at every stage, and in that sense, mitigation and adaptation are also investments. Gabriela spoke about avoided costs, and we need to talk here really about financial risk management. The floods in Slovenia 2 years ago, they caused damage which was worth about 16% of national GDP. And so this is money which is not available for anything else, including the ailing health sector. So we need, and yes, there is European funding, but it will not do it all. We need private investment, we need investment in all, but it's not just about trying. We need to invest smartly. From this perspective, how can we use this money to do many things at the same time, and of course to manage our financial risks as much as we can. I think this is really the challenge which we have. There was something else I wanted to say, but I forgot. Well, maybe I get back to you and we get into the discussion now.
I'm sure you'll remember in a little bit. Thank you so much for that, Peter. That really gets at the core, I think, for me is, this balance, like, and almost like a checkbox. Sometimes it feels like some folks are saying, no, we're going to do just mitigation, or we're just going to do adaptation, or what are we going to focus on, and what we should be putting our money, our very limited resources into. And I think what you suggest, an approach that really looks at these long-term investments that need to look at how they both can contribute to resilience is important. I'm going to open it up. I see one question in the chat or in the Q&A box. Kristen McCaskill, thank you so much for your question. I think this is for all panelists. It says, how mature, in quotes, do the panelists view the health sector in terms of evidence of practical progress with regards to adaptation? And I guess when we think of maturity, I mean, are we in infancy? Are we in a teenage stage? I have children, I have young children who are actually starting to get into that pre-teenage stage for me. Are we there? We're certainly not in adulthood, or are we? Maybe we are. How do you think this works in Europe? Who wants to start?
I can make a quick start, and then I let Alexandra and Christina come in. I don't think any single sector is mature from an adaptation point of view. The point which I made before is all our assessments which we do tell us that we are the pace of climate change climate change outpaces our actions. We are largely unprepared. And as Alexandra said, they did this wonderful study on that there is less climate in national health strategies than there is health in national adaptation strategies, which signals the health sector is still in a catch-up situation, even compared to the overall adaptation sector. But okay, there's now this engagement. This is great. And we do see this engagement, and we do see sort of a greater level of activity, often declarations. How does this translate into progress onto the ground? Well, I guess there is a lot left to be desired and a lot to be done. But one more final point for me is we also lack indicators actually to measure progress on adaptation on the ground. Things like does heat-related mortality actually increase or decrease compared to the increase in heat? That type of indicators. And this is something that's hopefully being developed now under the under the COP process and being presented at the Belém COP next year. And we will also certainly look into measuring of progress when we do the European Climate Adaptation Plan. But with all that said, back to Alexandra and Christina for their views.
I could say that climate adaptation is maybe in the middle of in the path from being a child to a teenager. There's some positive progress being made. As I've mentioned, in Galicia, climate resilience is already entering our health policies. But we're seeing some good signs, but there's a mixed bag. There's awareness, some policies are in place, but we still need to address gaps in funding, engagement, and execution, and of course, monitoring.
Maybe just to add, from the European Climate and Health Observatory perspective, we looked into some aspects, and actually tomorrow we will be publishing a brief report as the EA, looking at how the surveillance of heat impacts on health is carried out in the European countries, and also how many countries have done heat health action plans in place as one of the sort of small aspects of climate resilience in the health sector. I can't disclose the details, but let's say that the coverage is not complete across Europe. But we find it very, very difficult from the European level to actually track the implementation of actions. So we are very good at sort of spotting the development of the policies and so on, but not doing so well on tracking the practical implementation. What we do have is some case studies that can maybe work as an inspiration for others. But my experience is that it's notoriously difficult to find case studies of adaptation actions taken in the health sector. So here the plea to the participants of this webinar: if you have good case studies that would be worth sharing with others, please do share them with us. We will be happy to develop them further and let others learn from that. Because so far we haven't seen so many concrete examples of actions taking place.
That is amazing, and something that I hope that LIFE RESYSTAL as a project can also help bridge in terms of the case studies, but also if there are any existing already, of course, in the audience, please. I love this call for action and case studies from Alexandra, and please make sure that you share them. So I hear here funding, indicators, actions beyond plans, engagement still needed. And how do we better kind of translate and communicate perhaps what we are doing? So all of these are very, very important points. I have one more question here from the audience. Here it comes from Diana Radrianzoa, and I'm sorry if I'm mispronouncing your last name. How would you design/integrate the natural capital management needs assessment, water, waste, and their contribution to the health climate resilience related plans? No particular panelist for this, but anybody, any thoughts on this?
Unmute myself. I never learn it. I guess this reflects sort of this discussion on One Health or global health in a sense, or broader environmental health, and it's an absolute true argument that as I said before, we need a systemic approach to these things, and there are links between the management of water, natural resources, biodiversity, and health quite clearly. Each of them work in their own way. Again, with the Climate and Health Observatory, we try to sort of have an interdisciplinary approach to cover that ground as much as we can, and establish these links. I think operationally they still get broken down usually in health sector action. I mentioned before the Water Resilience Initiative, which of course has links to health, and health should be a part of this. But it's just operationally very difficult to make these things, just one single thing and have everyone around the table. Now, how do you quantify them? I don't have a magic solution here. I think Alexandra's got much more experience here. I would find this very, very difficult to come to sort of a satisfying answer soon to that question, because there are many, apart from data issues, also methodological issues like attribution and all that.
Alexandra, I don't know if you have any comments on that in terms of.
I can only agree with Peter.
Fair enough. Thank you for your question, Tiana. We have a couple more here, and also some kind of comments also. I have a question here from Katharina Weiss. Yesterday, I received a comment highlighting that building climate resilient communities requires significant time and resources, such as personnel and funding. This challenge seems especially pronounced in the health sector. where workloads are already stretched. How would you address this concern to be able to engage more stakeholders? Do you have one key tip to motivate people who are not yet involved in climate topics? Christina, I'm going to start with you on this one because I feel like Sergas may have something here to share with us.
Education and training. We recently set up an online education program that all the staff that work for the Galician Health Service can do. It's quite easy. It's available 24 hours, and it gives you like some credits for your career, and it's quite easy to follow. So basically, through projects and through education, as our staff see how we get involved in these projects related to mitigation and adaptation, that everybody wants to participate because climate change is there. We can all see these extreme events, natural disasters, and so engaging through education and projects for me is the key.
That's really important, Christina. And I think, from a global perspective, I'll say that, we found that those efforts are best. I think that often what we see in health systems is that you get like a champion, someone who's really, really into this topic and really pushes through and is fighting to get not just the funding, but the leadership to get behind it, to get the business case, if you will, even, right? But also when you see a system kind of taking this on in a more systemic way, and we've seen others that can create certain even competition or challenges or ways in which they also create a certain behavior change within their systems that are really innovative in a way that they get people engaged within education, but also outside of the education part of things. Excellent. I see one more question here, and thank you, Kristen McCaskill, for sharing your case studies. That would be really, really great to have also. I know they're not European particularly. I think it seems that they're North American, but probably very useful anyway. I see a question from Ana Fuster Munoz. Cristina, I think you in Galicia are pioneers in Spain related to adaptation. So I would say adaptation, at least in Spain, is very, very immature. But now you said that you're kind of going into adolescence, Cristina. So maybe something to share here. We need funding, but I think we still need awareness. Do you feel like that's the case in Spain, even more than in Galicia, perhaps, Cristina? I've seen the government of Spain really engaged in this, and actually they talked about it in the Spain pavilion at COP. Where do you think they are, and how can we help perhaps at a national level between all of us, right? Civil society, European Commission, observatory. What can we do to help the cause at a national level?
At the policy level, I think I think the situation is pushing policymakers to understand that building resilience is not just a nice to have. It's absolutely essential. But there is it's also important for me, and maybe this question is behind all these difficulties to engage. It's essential to connect local initiatives with public policies. In many cases, these links are missing, creating a gap between what's happening on the ground and what's being decided at the top. A few weeks ago, I attended a national expert meeting where we were discussing how local efforts are being mobilized in the absence of clear political commitment or at least visibility. So I think we need to create these links, these collaborative networks. In the LIFE RESYSTAL project, we set up the community of practices, and this is going to last. It's going to be there once the project ends, and we plan to extend it because one of our objectives is to scale the project, to use all this knowledge in the rest of the hospitals, in the rest of the healthcare facilities. So engaging, collaborating with other sectors, think about private sector, energy sector, transport sector, grants, local initiatives. I think that is the key, and is the response that could be behind how can we can make this awareness bigger.
Thank you so much for that, Christina. And I'm gonna finish with one last question that we have in the queue here. And it's from Travis Obuchinsky. How do you translate the benefits of systemic resilience programming to stakeholders for whom climate resilience and sustainability may be secondary to financial or operational concerns? What ways of framing have you found successful? Who wants to start?
Well, it's not exactly my field, but we do have, of course, colleagues who work on adaptation finance and how the financial services industry, banks, insurers, and so on come into the picture. And there's a growing concern, and it comes back also to the issue of funding and where do I get my money from? There's a growing awareness and growing work of finance providers, banks and insurers, for example, on climate resilience and from a financial risk management perspective, because of course they are alerted by the huge losses which we've seen by the last disasters. If you get through your investors and your finance providers a financial incentive or a financial penalty, as the case may be, for not being climate resilient or super climate resilient, then this definitely helps sharpen your mind for these things.
Thank you, Peter. Alexandra?
I think what we see is that, with every extreme event that happens in Europe now, whether it's floods or whether it's heat waves, that health sector is being impacted. We've seen the images of hospitals being flooded in Central Europe and in Spain. We've seen the headlines in the newspapers about 1/5 of hospitals in the UK cancelling operations during the heatwave in 2022. So I think that subject is becoming more and more relevant to people who might not have prioritized it in the past, because it really starts to impact them day-to-day operations and just the daily business in the health sector. So I think that using those examples, and especially if they are sort of close geographically or from a similar climate or from a country with similar health system or governance and so on, that they can really resonate with those who might not be usually prioritizing those issues.
Sorry, my microphone didn't go off. Thank you for that, Alexandra. Cristina, I don't know if you have anything to add to that.
In my case, a successful way of achieving some projects was working with equivalent cost. Sometimes we can find innovative solutions, nature-based, or even collaborating with a different sector, because we are always thinking about healthcare, operational, and sometimes we have to go out of the box, collaborate, and think another different solution that can have a similar or equivalent cost. So see, if you tell your CEO, okay, this is going to cost you the same, but we are going to be more resilient, we're going to improve our adaptation capacity, but it's going to cost exactly the same amount of euros. So maybe this could be a good way to get it.
Absolutely, Christina and everyone. I mean, if I have one more thing to add to this is, I would say don't necessarily hide from that financial perspective, right? I think it's important for leaders, and sometimes to make that business case is important. But I get why the question, right? That financial and operational benefits may be only for a particular time period. And also, I think that for the healthcare sector particularly, one important thing to consider is patient outcomes. That's also incredibly important to us, and should be very important to leadership in a hospital and a health system. We just came out of COVID, or we think we've come out of COVID. Still in some communities particularly strong, but we know what happened. We know what happens when something like that strikes us. And climate is not any different in many ways. So the more and more frequent these events happen to us, the more we're going to be in a situation where not only our finances will be stricken, but also socially will be particularly affected. I want to finish the webinar because we've reached time, but with a few closing remarks. First of all, thank you so much to our panelists. Thank you so much to our presenters earlier today. And thank you for your participation today in today's webinar. A huge thank you to the Healthcare Without Harm Europe team for organizing today's session and inviting these wonderful speakers for you. Now, a few things. Remember that you can find a practical guide for building climate resilient health systems in the Healthcare Without Harm Europe website. We will share the link in the chat for you now, so you can go there directly. You can also stay tuned by following us on our social media, especially LinkedIn, and the newsletter that the Europe office does for more updates on the LIFE RESYSTAL project and future events like this one that will help you learn more about how to build healthcare with climate resilience. Additionally, please take a few moments to complete the survey that will appear on the screen when this webinar ends. Your feedback will help us improve future sessions and offer more tailored support for building healthcare climate resilience itself. And then, just want to say thank you for being here. By working together and working on these aspects of healthcare, we can build resilient healthcare sector in Europe and globally, and one that adapts to climate change, builds sustainability, is low carbon, is great for patient outcomes, is great for quality, and protects both people and planet. Thank you so much for the opportunity to be here, and until the next time.
Thank you very much.